So the two groups of children that we need to consider: one, the children who are younger, usually the ones under 5 years of age, and second group would be the ones who are older than 5 years of age. The presentation of the ones older than 5 years of age are almost like what adults, patients with appendicitis would present with. Now, so what they present with usually is a typical non-specific tummy pain in the belly button area, and then a more specific pain in the right side. So the pain starts non-specific there and then very specific there. Usually that's the first indication of appendicitis, and then other symptoms might appear, such as vomiting or fever, which is not very high grade. The fever typically is about 37.5 to 38 degrees Celsius. And then they might have other issues such as vomiting and also diarrhea. That is what the symptoms normally present with, and also that's different from other causes of tummy pain such as gastroenteritis, which is the other most common cause of tummy pain. With regards to the children under 5 years of age, they present atypically. They may be having non-specific tummy pain, they might be lethargic, they're just not moving very much, just holding the tummy, not willing to eat, not willing to drink, and may have diarrhea. The problem with children under 5 years of age is that the appendix will burst very early. So within a day, the appendix might burst, unlike the older children where it might take 2 or 3 days before the appendix bursts. So it's very important to identify symptoms of appendicitis in the under 5 years of age, because they need to be treated as soon as there's any symptoms, because they will burst. And when the appendix bursts, there will be peritonitis, which can make the child very sick.
And how quickly do these signs present themselves? I mean, is it a gradual build-up, or will suddenly just occur?
Usually the under 5s, it's quite quick. Within 6 to 8 hours, they seem to be moving from a little bit of pain, and then they're just lethargic and not moving at all. So that's a critical sign. When they are not moving at all and they are just not willing to eat and drink, I think that's best to take the child to the hospital. If the other signs such as diarrhea first, is as likely to be appendicitis. But pain as a prime symptom, as a starting symptom, is more likely to be appendicitis. So if you think that the child is not behaving themselves as they normally do, and they seem to be in a great deal of pain, it's best to visit your local hospital. So when you take them to the local hospital, if you ideally take them to a hospital where there is a pediatric surgeon, and once they are at the hospital, then routine examination will be done. Sometimes, most likely, they will need some blood tests to check for something called the white cell count, looking at any signs of inflammation, and also some other inflammatory markers. And the other thing they might do is to do an ultrasound scan of the tummy. I very rarely do CT scans of the tummy for children. For the CT scans involve reasonable amount of radiation. So once the ultrasound scan is done and the blood test is done, and once the examination is done by the surgeon, then he can put all the picture together to decide whether it's appendicitis or not.
Typically, how long does it take to be able to deliver that diagnosis from when they come in to getting news confirmation?
Yeah, so within an hour or two, we'll be able to diagnose it. Okay. In the meantime, we'll make sure the child is not dehydrated, because most likely if they are in pain or if they are not comfortable, they often refuse to drink or eat, and we'll rehydrate them first. And once the diagnosis is confirmed, antibiotic is given, and then within two hours or so, the child will be in the operating theatre having the appendix removed, ideally by the keyhole technique. If it's appendicitis, then the first thing they do is to give some intravenous antibiotics prior to doing surgery to remove the appendix, and if there's perforation, to clear out the pus from the tummy. which is the cause of significant illness in the child, which is the perforated pus in the tummy will cause them to be very sick.
And when it comes to appendicitis, it always requires surgery. Is that correct?
There are various different options conducted by other units, but my preferred way is to remove the appendix, because the other conservative method of giving antibiotics is not reliable. Not all of them will recover after the appendix with the treatment of antibiotics, and significant number of them will return with a repeat appendicitis. So treating just with antibiotics is not a treatment of choice, which is what's been done for over 100 years really. If you get appendicitis, you remove the appendix. So if you don't take the appendix out, if it's still not perforated or burst, then it might end up bursting, and the child might end up being very sick. And very rarely, they might end up in the ICU for intensive care, which is not what we like for any child really. Generally, once the appendicitis is diagnosed, the appendix comes out. And that's the best way of treating any acute appendicitis, especially so for the under 5 years of age, because they will end up having the appendix burst and cause them to be very sick.
Right. So to recap, your recommendation is for parents to look out for severe pain in the tummy. Should they discover that, it's always best to take immediate action by taking the child to a hospital, preferably with a pediatric surgeon, and quickly get that diagnosed.
That's right.
Correct?
Yeah.
Okay. Thank you, Doc.